I want to walk you through some of the top signs your liver might not be functioning the way it should. One possible sign is swelling in the legs or ankles. Have your socks been leaving deep imprints, or your shoes suddenly feel tight? That swelling, called edema, can be a silent clue that your liver is struggling. There are two main reasons this happens in liver disease. One is low albumin levels. Albumin is a protein made in your liver. Think of it like a sponge that keeps fluid inside your blood vessels. When the liver stops producing enough albumin, fluid leaks out into surrounding tissues and you get swelling. The second is portal hypertension. In liver disease, especially cirrhosis, scarring blocks blood flow through the liver. Pressure builds up in the veins in the liver due to this scarring, and fluid backs up in the abdomen and the legs. Fatigue can be a major sign of liver disease. This isn't just feeling tired after a long day. This is deep, relentless exhaustion where you wake up tired and stay tired. When your liver is damaged, inflammatory chemicals increase, draining your energy. Toxins like ammonia build up in your bloodstream. Also, your blood sugar storage in the liver is impaired, so your fuel runs low. Liver disease causes decreased red blood cells, so less oxygen is transported in your body. Jaundice is another symptom, which is yellowing of the eyes or skin. This happens when your liver can't clear bilirubin, a yellow pigment that forms when red blood cells break down. Normally, your liver processes bilirubin and sends it into the bile to be excreted. But if that process slows down or stops, bilirubin builds up in your blood and settles in your skin and eyes. Have you noticed your urine turning dark like tea or Coca-Cola and your stool looking pale or grayish? This can happen when bilirubin builds up in your blood and then gets filtered through your kidneys and causes the urine to look dark. At the same time, if not enough bile reaches your intestines, your stool loses its normal brown color and turns pale. One of the most underappreciated symptoms of liver disease is generalized itching. It often affects your palms and soles and tends to be worse at night. This itching is from bile acids and other substances that accumulate in the skin when the liver cannot excrete them properly. If you bruise easily or bleed more than usual from small cuts, this could be another sign of liver disease. The liver makes proteins called clotting factors that help your blood stop bleeding. When your liver is damaged, those proteins aren't made in normal amounts, so even minor bumps can leave large bruises. You might also see petechiae, which are tiny red or purple dots caused by bleeding under the skin. Have you ever noticed both of your palms looking red or flushed? This is called palmar erythema, and in many cases it's harmless. But in other cases it can point to serious liver dysfunction. A damaged liver cannot break down estrogen effectively. Estrogen buildup causes blood vessels in the palms to dilate, making them appear red, though it doesn't hurt. Brain fog, confusion, irritability, or subtle personality changes can occur when the liver cannot filter toxins such as ammonia. These toxins can affect your brain. This condition is called hepatic encephalopathy. Spider angiomas are small, red, spider-like clusters of blood vessels. You'll often see them on the chest, face, or arms. They're also related to estrogen buildup from liver dysfunction, just like palmar erythema. If you spot several of these, especially in men, it's worth looking into possible liver disease. If you notice any of these signs or symptoms, don't wait. Ask your doctor about checking your liver function tests, including ALT, AST, bilirubin, albumin, and clotting factors. The earlier liver disease is caught, the better your chances of stopping or even reversing damage. Thanks for watching. This is not medical advice, just educational information.